I've had a cough for a couple of days and a fever with chills. I feel weak and lethargic.
His temperature is 102 and his heart rate is 120. His blood pressure is 96 to over 60.
I think he has pneumonia.
Do you think he might have sepsis?
I didn't think of that. His blood pressure's okay, though.
Patients can have sepsis, even with a normal blood pressure.
Nurse, that's a great catch. I hadn't thought of that. He might have sepsis.
That SepsisDx app would help you diagnose sepsis. Sepsis is a common and important public health problem, leading to thousands of patient deaths every year. Sepsis has become the single condition that costs hospitals the most money. Studies show that evidence-based care improves outcomes for sepsis. Regulators have introduced new standards and they measure how well doctors and hospitals stick to these guidelines. The core measures are based on expert guidelines. They are sensible but complicated. The time frame for completing the core measures is up to 6 hours. In this time, a patient may receive care from several providers in multiple locations in the hospitals. Hospitals that participate in Medicare and Medicaid, basically all hospitals in the USA, must report their compliance with these core measures.
What do we need to do to evaluate if this patient has sepsis?
We need to draw some lab tests and give antibiotics, and we need to do that within 3 hours.
I have been here for an hour already.
I'll write the orders. Nurse, please draw blood cultures, a blood count, a lactate level, and a metabolic profile. Give wondermycin and kilomolaquin.
I feel a little dizzy.
Honey, the blood pressure is now low. Do you want to prescribe some IV fluids?
Another great catch. Yes, let's give IV fluid. How much does this patient weigh?
75 kilograms.
Let's give 2 liters of saline. That's around 30 milliliters per kilogram, I think.
Actually, it's too little.
Well, it might be close enough.
SepsisDx will tell you the exact amount.
Doctor, you need it in the trauma room. 2 car crash victims need immediate evaluation.
Hey, how's that patient with pneumonia and sepsis?
Not so well. His kidneys are failing. I sent the lab test and gave him the antibiotics and the IV fluids you ordered. Did you check the results of the lab test?
Oh no, I forgot. I got totally caught up taking care of those trauma patients. Now more than 3 hours have passed. Shoot. We missed the core measures again.
The hospital is a busy place. Nurses and doctors have many patients under their care. It is difficult to remember that certain tasks must be completed by a specific time. Some hospitals use alerts through the electronic medical record, or EMR.
Gotta write my notes. Gotta enter my orders. Oh shoot, I forgot those lab results on the patients with sepsis. Now that I'm sitting back at a computer, the EMR just reminded me that I needed to check within 3 hours. That was an hour ago.
Doctor, we need you in the trauma room stat.
Wait, just a second. I've got to check on some lab tests and enter a couple of orders.
By stat, I mean now, like right now.
Yeah, just a second.
With SepsisDx, you wouldn't need to sit at the computer all the time. SepsisDx doesn't require doctors and nurses to be at a workstation. SepsisDx is a mobile app that reminds clinicians what tasks they need to complete and when. It doesn't tell you what to do, but aids you in making the final call. Complying with the sepsis core measures is easier and faster with SepsisDx. It also allows the clinician to electronically hand off a patient to the next clinician.
Ooh, look, I've just got an hour to check on that lactate level for the patient with sepsis. I should talk to the nurse to be sure it got sent. Hello, did you send that lactate level for Mr. Jones?
Yeah, about 45 minutes ago. And the first antibiotic is infusing, along with the saline you ordered. The patient is doing much better.
Great. Hey, look, the lactate is elevated at 6. It's a good thing we gave those fluids.
Maybe you should call the ICU to admit the patient?
Nurse, what a great catch. This patient's pretty sick.
SepsisDx helps you triage the patient.
SepsisDx puts sepsis care in the palm of your hands.
Or on your wrist. SepsisDx helps give the right care at the right time. SepsisDx could be a lifesaver.